Hello, welcome to another one of our Dr. Foot videos. I wanted to make a short video about a conversation I had with a patient recently, and it got me thinking, where are we going as a profession? Let me give you a little bit of context. This patient has been getting problems with her ankle for some time. She went to see a foot care assistant, also known as an FCA, then went to see a podiatrist, and then finally came to me. Now, the foot care assistant gave her some exercises to do, which were not bad at all, actually quite impressed, to give her more stability around the ankle joint. The podiatrist gave her some orthotics. Neither really treated the underlying cause, and neither didn't give her a rehab program that was progressive. The reason why I found this conversation interesting was there was a lot of friction and a lot of back and forth with the foot care assistant and the podiatrist. So let me give you a little bit of context and a bit of knowledge about what both of these individuals do. So a foot care assistant does a short course, can be between 4 weeks to 12 weeks, and then starts to treat feet. It's fine because they do basic foot care generally. A podiatrist does a 3-year degree and then is regulated by the HCPC, and we're always doing other courses, CPDs we call it, and we're always enhancing our knowledge and finding out what the latest evidence-based treatment is for any particular type of condition. I don't have a problem with FCAs personally. I send a lot of patients to FCAs for regular foot care treatment. FCAs send me patients for patients that are a bit more complex, and I think that's the way it should work. Very much like how it does in the dentistry model, where we have dentists and hygienists. I think it should be a similar model. The only problem is that we're not regulated the same way that dentists are regulated. But there was a lot of friction between the foot care assistant and the podiatrist, and I think the reason why that is some podiatrists, they don't level up. When I say level up, they haven't done more courses. They haven't tried to expand their knowledge. They think that cutting nails and treating corns is all that a podiatrist should do. It really shouldn't be. I mean, I'll tell you the truth, I'm not the best at cutting nails and taking corns out. There are better podiatrists out there to do that kind of work. I'm really good at treating sports injuries, biomechanics, a whole host of other things, but regular foot care isn't my forte. But I'm not looking down upon other podiatrists that do that, but I do think we as a profession need to move on. We cannot be so obsessed with just doing the basic stuff, especially for podiatrists that have been doing it for some time. Now, I've qualified in 1995, a long time ago, and I still have some colleagues who are still doing regular stuff, which is fine if that's what they wish to do. But as a profession, as a whole, I think we need to do more courses. Podiatrists need to do more courses. We need to expand our scope of practice and do a lot more. So when I qualified, we were not even allowed to give out antibiotics, and now podiatrists can prescribe or give orders for specific types of antibiotics. If you do an additional course, you can prescribe any medication as long as it's within your scope. We weren't allowed to do injections. Now we're doing steroid injections, PRP, plurotherapy. Some of my colleagues are doing stem cell treatment, injections in the feet and the knees. Brilliant. We're taking blood to do blood tests, shockwave, skin surgery, and the list goes on and on. Some of my younger colleagues who have just qualified, their depth of knowledge is a lot better than what ours was when we qualified. So as a profession, I can see where the universities are taking us, where we are moving forward. On the other hand, there is a lack of students within many universities. Now, there's various factors for this. One of the factors is foot care assistants, because there's so many FCAs that are coming out and they're taking the regular podiatry work, and I don't think that's going to change. I think that's always going to remain the same. So we as a profession, instead of being so obsessed with doing the regular foot care, we should be doing even more. We should be extending our scope even more, so that we can do more complicated treatments and procedures, and not be so obsessed with, well, in my opinion, to do regular foot care. We need to level up. Everybody needs to level up. If you're stagnant in life, you're not going to get anywhere, and people are going to overtake you. You as an individual need to have that self ambition and drive in you, thinking, okay, I need to learn more, and I need to accomplish more in the way of knowledge. Knowledge is like a sea. You can never get to the end of it. You carry on swimming deeper and deeper and deeper, and learn more and more to try and help your patients. Anyway, I found this conversation with the patient interesting, because it got me thinking about, where as a profession do I want to see our profession going in the next 10 to 15 years? And I want more for the profession that I love. I want podiatrists to be doing more extended scope treatments, and I want them to be really proficient at what they do. Thank you for listening. I hope you found this interesting. Better finish off my coffee and get to my patients. Take care. Bye.